Good morning, guys. I've got discussion here for you. This morning we're talking about America's caregiving crisis. Okay, so we'll get into that now for discussion A. Here we go. America's aging. America is aging fast. Roughly 1 in 6 Americans are already over 65, and this is projected to reach about 1 in 4 by 2050 as needs for medical care and daily support grow. Families not families not from formal systems are absorbing the burden, with women disproportionately stepping in as primary caregivers. At the same time, the paid caregiving workforce is strained by low wages and high burnout, leaving more care to be done at home without adequate support. Why women 60 plus are central to caregiving. Demographics and roles. Women in their 60s and 70s are frequently caring for spouses or partners with chronic conditions, their own aging parents, and sometimes grandchildren, because multi generational care needs are rising, while affordable formal care remains limited. Workforce demographics, with home care agencies struggling to recruit and retain workers, older women often fill the gaps, coordinating medical visits, managing complex care at home, and providing daily support that the formal system cannot reliably supply. The hidden costs, health, finances, and isolation. Health toll. Family caregivers report higher rates of physical strain and poorer health, especially when care is complex and long-term patterns that intensify for older caregivers. Managing their own aging own aging related needs while caregiving for others. Financial strain. Caregiving disrupts careers and retirement security through reduced pay, work, unpaid leave, and out of pocket expense costs. A national caregiving report notes widespread financial stress and isolation among caregivers, reflecting a scale of unpaid labor that reaches tens of millions of adults. Emotional load. Stories from caregivers nationwide depict exhausting coordination, hospital stays, and work expectations that continue even during crisis, illustrating how care responsibilities often collide with employment realities with little structural relief. Scale and system pressures. Rising numbers. Nearly 1 in 4 U.S. adults provided ongoing care for someone with a complex medical condition or disability in the past year. About 63 million people, up sharply over the past decade. Most are caring for adults, and many are family members navigating complex care without formal backup. Labor shortages. The senior caregiving sector is growing, but under reduced low pay and difficult conditions limit workforce supply, shifting more responsibility onto family and especially older women. What the surrounding content emphasizes. Primary caregivers are mostly women, reporting uh, highlights women's disproportionate role and the often unseen costs, economic, health, and social, become borne by those in their 60s and beyond. Structural gaps. Articles connect personal stories to system failures, inadequate pay, leave, unaffordable long-term care, and inconsistent home care availability, making older women the de, the de facto safety net. Policy relevance. The convenience of demographic aging caregiver, health impacts, and workforce shortages signals a policy crisis. That requires stronger supports, paid leave, respite care, affordable long-term care services, and better pay for caregiving jobs to relieve the burden uh, concentrated on women 60 plus. The bottom line, women over 60 are carrying a disproportionate share of America's care work because the population is aging. Formal caregiving systems are underpowered, and family care remains the difficult. The result is unintensified health risks, financial strain, and isolation for older women, magnified by labor shortages and inadequate policy supports. Okay, guys, that is your A for today. I will be back on in a bit for B. For now, Gator Wellness. Take care, folks.